Hello everyone, myself Dr. Ganesh, Assistant Professor at RNK Memorial Homeopathic Medical College and Hospital Indore. So today's my topic is anatomy of elbow joint. So हम लोग जो डिस्कस करने वाले हैं हमारे टॉपिक को, and these are the following contents. First, type of joint, articulating surfaces, क्या क्या articulate हो रहा है जो joint को form कर रहा है, जो surfaces हैं, and ossification centers, ligament, tendon, relations to the elbow joint, क्या क्या relations होंगे elbow के, blood and nerve supply, movement at the elbow joint, carrying angle, and last one is applied anatomy. So first, type of joint. So elbow joint is a synovial joint of hinge variety. Articulating surfaces, दो articular surface है, एक upper side होगा, एक lower side होगा. Upper में capitulum and trochlea of the humerus. Lower one is upper surface of the head of the radius, articulates with the capitulum. Now second is trochlear notch of ulna, articulate with the trochlea of the humerus. You can see over here, here is a capitulum which is articulate with the head of the radius, and trochlea is articulate with the trochlear notch of ulna. Now, the elbow joint is continuous with the superior radioulnar joint between head of the radius and radial notch of ulna. Now come to the ossification center. Ossification centers क्या होते हैं? जब बोन डेवलप होकर या तो बोन का बॉडी बनाता है या सैफ्ट बनाता है, तो कैपिचुलम होता है, उसका जो ओसिफिकेशन सेंटर है वो 1 से 2 साल यानी 1 to 2 years में होता है, एंड मीडियल एपिकोंडाइल जो कि 4 years में, ट्रोक्लिया 8 years में, एंड लेटरल एपिकोंडाइल which is ossify in 10 years. Now come to the ligaments. किसी भी जॉइंट्स को लिगामेंट एक तरह का स्ट्रेंथ और स्टेबिलिटी प्रोवाइड करवाता है. सो एल्बो जॉइंट के जो लिगामेंट्स हैं वो है रेडियल कोलेटरल लिगामेंट, अल्नर कोलेटरल लिगामेंट which is having anterior band, posterior band and oblique band. Third one is capsular ligament and fourth one is annular ligament. Now we discuss one by one. Radial collateral ligament, it is a fan-shaped band extending from the lateral epicondyle to the annular ligament. ये आप पिक्चर्स में देख रहे हैं, ये lateral epicondyle है जो कि lateral epicondyle से extend होकर annular ligament तक जा रहा है. Radial collateral ligament provides lateral stability and is rarely injured. Now come to the second ligament, that is ulnar or medial collateral ligament. Is a triangular in shape. ये एक triangular shape होता है जो कि apex attach होता है medial epicondyle of the humerus and its base to the ulna. You can see over here in the diagram. The ligament has thick anterior and posterior bands. These are attached below to the coronoid process and the olecranon process of ulna. And ulnar collateral ligament is a critical in providing medial support. जैसे कि medial side होता है तो ये medial stability provide करवाता है. Now come to the capsular ligament. जैसे name suggest है, capsular means एक capsule form में रहेगा. So superiorly it is attached to the lower end of the humerus in a such a way that capitulum, the trochlea, the radial fossa, coronoid fossa and the olecranon fossa are intracapsular. ये सारे structures capsules के अंदर होगा. That's why intracapsular. Now infiromedially. Infiromedially it is attached to the margin of the trochlear notch of the ulna except laterally. अब laterally क्या होगा attach इसका? It is attached to the annular ligament of the superior radioulnar joint. Now come to the annular ligament. You can see over here in diagram, annular means a ring shape which is covers the head of the radius that wraps around the radial head of and hold it tight against the ulna. You can see over here in diagram. Now come to the tendon. दो तरह के tendon है, biceps tendon and triceps tendon. Biceps जो कि front of the elbow है, triceps जो कि back of the elbow है. Anteriorly, it allows the flex with the force. Now, triceps posteriorly allow elbow to extend with the force. Now, what is the relations of the elbow joint? So anteriorly, it is related to the brachialis muscles, median nerve, brachial artery, and tendon of biceps brachii. You can see over here in diagram, here is brachial artery, median nerve, and tendon of biceps brachii. Now come to the posterior relation. It is related to triceps brachii muscles and anconeus, only having two muscles on posterior side. Now come to the medial relation, that is ulnar nerve, flexor carpi ulnaris, and common flexors. Now laterally it is related to the supinator, extensor carpi radialis, and other common extensors. Now come to the more important content, that is blood supply of the elbow joint. So blood supply of elbow joint, which is from anastomosis around the elbow joint, which includes recurrent and collateral branches from brachial and deep brachial arteries. You can see over here in diagram, brachial artery divided into profunda brachii artery, and it gives two branch, radial collateral artery and posterior descending artery, which is anastomos over here on the lateral side from radial recurrent artery and introosseous recurrent artery. Same side on medial, it is anastomosis with the anterior ulnar recurrent artery and posterior ulnar recurrent artery. Okay. Now come to the nerve supply. So elbow supply by the radial nerve, ulnar nerve, medial nerve, and musculocutaneous nerve through its branches to the brachialis. Now come to the movements. So दो तरह के ही movements यहाँ पे possible है. One is flexion and second is extension. जो flexion है वो जो brought होता है वो mainly brachialis muscles, biceps brachii and brachioradialis muscles से, और जो extension होता है which is helped by the triceps brachii and anconeus muscles. Now flexion. What is flexion? Movement of forearm to the shoulder is by bending elbow to decrease the angle. यहाँ पे डायग्राम में जैसे एंगल डिक्रीज हो रहा है between arm and forearm के बीच में. Now come to the extension. Extension means opposite to the flexion. The movement of forearm away from the shoulder by strengthening the elbow to increase the angle. Right, opposite to the flexion. Now come to the carrying angle, which is very important for the day-to-day activities. When arms are held outside and palm are facing forward, forearm and hand should normally be about 13 degrees away from the body. This is a normal carrying angle. This angle allows forearm keep proper distance from hip when swing the arm, such as during walking. Right, you can see in picture the carrying angle which is formed by the long axis of arm and long axis of forearm. उन दोनों के बीच में जो एंगल बन रहा है that is the carrying angle, और ये जो normal होता है वो around 13 degree होना चाहिए. So normal values in men around 15 degree and female around 20 degree. And what is the factor which is responsible to make a carrying angle? First, medial flange of the trochlea is 6 mm deeper than the lateral flange. जो trochlear flange होता है वो 6 mm deeper होता है as compared to the lateral flange. Second, superior articular surface of the coronoid process of ulna is placed oblique to the long axis of the bone. यहाँ पर डायग्राम में जो coronoid process है वो कैसे प्लेस होता है? Obliquely on a long axis. That's why it gives more deeper at compared to the lateral side. Now the carrying angle is disappear in full flexion of the elbow and also during the pronation of the forearm. दो conditions होती है वहाँ पर ये एंगल रिड्यूस हो जाता है या नहीं दिखता है हमें. One is जब हम elbow flex करते हैं और second जब हम pronation position में होते हैं. नाउ एबनॉर्मलिटी ऑफ कैरिंग एंगल, क्या क्या एबनॉर्मलिटीज हो सकती है कैरिंग एंगल में? सो दो तरह का है, एक क्यूबाइटस वेरस एंड क्यूबाइटस वल्गस। सो क्यूबाइटस वेरस में क्या होता है, कैरिंग एंगल रिड्यूस हो जाता है या कम होता है अराउंड 5 डिग्री, और क्यूबाइटस वल्गस में जो एंगल होता है वो इंक्रीज हो जाता है मोर देन 15 और 20 डिग्री। नाउ कम टू द अप्लाइड एनाटॉमी। So first, tennis elbow. Tennis elbow, which is very common to tennis player. That's why it name kept as a tennis elbow. Occurs in tennis player. Abrupt pronation with fully extended elbow may lead to pain and tenderness over the lateral epicondyle, which gives attachments to common extensor origin. जहाँ से लेटरल साइड से कॉमन एक्सटेंसर ओरिजिन हो रहा है मसल्स का, टेंडोन का, वहां बार बार रिपीटेड इंजुरी होता है, स्पेशली टेनिस एल्बो। टेनिस एल्बो जो कि सचिन तेंदुलकर जो हमारे वन ऑफ द फाइनेस्ट प्लेयर थे क्रिकेट के, उनको भी टेनिस एल्बो हुआ था क्योंकि वो भारी बैट कैरी करते थे, उसकी वजह से उनको टेनिस एल्बो हुआ था, और वेरी प्रोन टू इन टेनिस प्लेयर। Now come to the golfer elbow. The golfer elbow is the microtrauma of medial epicondyle. वहां पर लेटरल साइड के जो एक्सटेंसर कॉमन ओरिजिन्स के टेंडोन थे वहां पर था, अब यहाँ पर कहाँ हो रहा है, मीडियल एपिकोंडाइल्स के जितने भी टेंडोन है वहां हो रहा है, राइट, अपोजिट टू द टेनिस एल्बो। सो अकर्स कॉमनली इन गोल्फ प्लेयर्स, ये गोल्फ प्लेयर में कॉमन है, राइट। नाउ कम टू द स्टूडेंट्स एल्बो। इट कैरेक्टराइज्ड बाय इफ्यूजन इनटू द बर्सा ओवर द सबक्यूटेनियस posteriorly posterior surface of the olecranon process। क्या होता है कि बार बार जब हम जैसे कि स्टूडेंट्स में बहुत कॉमन होता है, वो डेस्क का हमेशा सपोर्ट लेते हैं एल्बो के थ्रू, तो वहां पर क्या होता है, इफ्यूजन होने लगता है, कहाँ पर, सबक्यूटेनियस साइट पर। सो उसकी वजह से उनको पेन, टेंडरनेस और इन्फ्लामेशन स्टार्ट हो जाता है उसके बाद से, राइट। सो स्टूडेंट एल्बो। नाउ कम टू द सबलक्शन। The head of the radius occurs in children when the forearm is suddenly pulled in pronation. The head of the radius slips out from the annular ligament. You can see over here in the image, जो annular ligament है, वहाँ से head of the radius pulled out हो जाता है उसकी वजह से, that is the very common in children when we are carrying with the hand. Now second applied is supracondylar fracture. जैसे ये नेम सजेस्ट है, सुप्राकोंडाइल मींस condyle, supracondyl का fracture. This is the most common fracture to occur around the elbow in children, around 60%. Usually the distal fracture fragment displays posteriorly. जो इसका fracture होता है वो posteriorly displace हो जाता है. You can see over here in diagram, supracondylar fracture. Now come to the fracture of capitulum. The mechanism क्या रहेगा, head of the radius impacted capitulum, then result into a capitulum fracture. You can see over here. Now olecranon fracture, as name suggests, ये fracture कहाँ का होगा, olecranon process का होगा, right? So mechanism of injury direct और indirect दोनों है. Direct में क्या होगा, fall on flexed elbow and marked displacement of the major fragment. यहाँ पर क्या होगा, जो fracture होगा वो major fragment means जो fracture होगा उसका जो एरिया होगा वो ज्यादा होगा, और इनडायरेक्ट में क्या होगा, फॉल ऑन द आउटस्ट्रेच आर्म प्रोड्यूसेस एन ओब्लिक और ट्रांसवर्स फ्रैक्चर विद मिनिमल डिस्प्लेसमेंट। इसमें इतना ज्यादा फ्रैक्चर जो अमाउंट होगा वो नहीं होगा, राइट। सो डायरेक्ट और इनडायरेक्ट। नाउ कम टू द कोरोनॉइड फ्रैक्चर। अब ये कहाँ का है, कोरोनॉइड प्रोसेस ऑफ अल्ना, राइट। सो इट इंडिकेट्स severe trauma to elbow. Mechanism of injury, striking of trochlea in coronoid. It is less common. Now head of the radius fracture. अब ये कहाँ का है, fracture head of radius का, तो mechanism क्या होगा, while arm is pronated, head impacted in capitulum, और it is very common to adult. Adult में सबसे commonly होगा, right? Now come to the radial neck fracture. Radial neck fracture, ये कहाँ का है, most common radial neck fracture is an impaction at the junction of head and neck of the radius, right? Radial neck fracture. Now come to the classification of dislocation. अब dislocation किस तरह के होंगे, that is the first one is posterior, which is very common. anterior dislocation, lateral dislocation, medial dislocation, and divergent. These are the dislocation of elbow. So now come to the posterior dislocation. में यहाँ पर क्या हो रहा है, जो olecranon process है, it goes to the posterior, to the elbow. You can see over here in X-ray also. Now come to the lateral dislocation of elbow. यहाँ पर क्या हो रहा है कि जो elbow है वो कहाँ पर displace हो रहा है, on lateral side. That's why lateral dislocation of elbow. And opposite to the lateral, that is medial dislocation of elbow. यहाँ पर क्या हो रहा है, जो elbow है वो medial side में shift हो रहा है, वो dislocate हो रहा है. Now divergent means जो अल्लर और जो रेडियस है वो दोनों शिफ्ट हो जाते हैं अपने अपने साइड, और वहां का जो डिसलोकेशन है दैट इज डाइवर्जेंट. एनी डायरेक्शन, वी कैन से एनी डायरेक्शन. नाउ we start a play for the animated video to understand the elbow joint.
At first, the elbow seems to work like a simple hinge. The elbow is a complex joint whose motion affects the forearm and the wrist joint. It is easy to see why the elbow can cause problems when it does not function correctly. Part of what makes us human is the way we are able to use our hands. Effective use of our hand requires a stable, painless elbow joint. The important structures of the elbow can be divided into several categories. These include bones, joints, ligaments, tendons, muscles, nerves, and blood vessels. The bones of the elbow include the humerus, or the upper arm bone, the ulna, the larger bone of the forearm on the opposite side of the thumb, and the radius, the smaller bone of the forearm on the same side as the thumb. The elbow itself is essentially a hinge joint, meaning it bends and straightens like a hinge. But there is a second joint where the end of the radius, or the radial head, meets the humerus. This joint is complicated because the radius has to rotate as you turn your hand palm up and palm down, while at the same time it has to slide against the end of the humerus as the elbow bends and straightens. To make this motion possible, the radial head is shaped like a smooth knob with a shallow cup at the end. This shallow cup fits against the capitellum, a rounded knob at the end of the humerus that forms part of the elbow joint. The smooth rim of the radial head is also covered with articular cartilage and glides against a small indentation in the ulna. Articular cartilage is the material that covers the ends of the bones of any joint. Articular cartilage can be up to 1/4 of an inch thick in the lower.
So here the articular cartilage. तो cartilage का काम क्या है कि जो तो बोन का जो बोनी सरफेस होता है उसके फ्रिक्शन को ये कम करता है, या आपस में फ्रिक्शन ना हो इसको प्रोवाइड करने के लिए ये आर्टिकुलर कार्टिलेज होता है, राइट?
Large weight-bearing joints. It is a bit thinner in joints such as the elbow, which don't support weight. Articular cartilage is white, shiny, and has a rubbery consistency. It is slippery, which allows the joint surfaces to slide against one another without causing any damage. Articular cartilage functions to absorb shock and provide an extremely smooth surface to make motion easier. We have articular cartilage essentially everywhere that two bony surfaces move against one another or articulate. In the elbow, articular cartilage covers the end of the humerus, the end of the radius, and the end of the ulna. There are several important ligaments in the elbow. Ligaments are soft tissue structures that connect bones to bones. The ligaments around the joint are connected with a thin layer of connective tissue and form a structure called the joint capsule. The joint capsule is a watertight sac that surrounds the joint and contains lubricating fluid called synovial fluid. In the elbow, two of the most important ligaments are the medial collateral ligament and the lateral collateral. The medial collateral ligament is on the inside edge of the elbow. The lateral collateral ligament is on the outside edge. Together, these two ligaments connect the humerus to the ulna and keep it tightly in place as it slides through the groove at the end of the humerus. These ligaments are the main source of stability for the elbow. They can be torn when there is an injury or dislocation to the elbow. If they do not heal correctly, the elbow can be too loose or unstable. Another important ligament for elbow function is the annular ligament. This ligament wraps around the radial head and holds it tight against the elbow. The word annular means ring-shaped, and the annular ligament forms a ring around the radial head as it holds it in place. This ligament can be torn when the entire elbow or just the radial head is dislocated. There are several important tendons around the elbow. Biceps tendon attaches the large biceps muscle on the front of the arm to the radius. It allows the elbow to bend with force. You can feel this tendon crossing the front crease of the elbow when you tighten the biceps muscle. The triceps tendon connects the large triceps muscle on the back of the arm with the ulna. It allows the elbow to straighten with force, such as when you perform a push-up. The muscles of the forearm cross the elbow and attach to the humerus. The outside or lateral bump just above the elbow is called the lateral epicondyle. Most of the muscles that straighten the fingers and wrist all come together in one tendon to attach in this area. The inside or medial bump just above the elbow is called the medial epicondyle. Most of the muscles that bend the fingers and wrist all come together in one tendon to attach in this area. These two tendons are important because they are a common location of pain caused by a condition called tendinitis, or perhaps more accurately, tendinosis. All of the nerves that travel down the arm pass across the elbow. Three main nerves begin together at the shoulder: the radial nerve, the ulnar nerve, and the median nerve. These nerves carry signals from the brain to the muscles that move the arm and hand. The nerves also carry signals back to the brain about sensations such as touch, pain, and temperature. Some of the more common problems around the elbow involve problems with the nerves. Each nerve travels through its own tunnel as it crosses the elbow. Because the elbow must bend a great deal, the nerves must bend as well. Constant bending and straightening can lead to irritation or pressure on the nerves within their tunnels and cause problems such as pain, numbness, and weakness in the arm and hand. These conditions are sometimes called nerve entrapment or nerve compression syndromes. Traveling along with the nerves are the large vessels that supply the arm and hand with blood. The largest artery is the brachial artery that travels across the front crease of the elbow. If you place your hand in the bend of your elbow, you may be able to feel the pulsing of this large artery. The brachial artery splits into two branches just below the elbow: the ulnar artery and the radial artery. These two branches continue into the hand. Damage to the brachial artery can be very serious because it is the major blood supply to the forearm and hand. As you can see, the elbow is more than simply a hinge. It is designed to provide maximum stability as we position our forearm to use our hand. When you realize all the different ways we use our hands every day and all the positions in which we place our hands, it is easy to understand how hard daily life can be when the elbow doesn't work well.
Thank you, everyone. My next lecture will be on the anatomy of wrist joint. Thank you so much.